Today I'm going to talk about Invisalign attachments, what they are, how they are placed, and everything you need to know about them. Hello everyone, I'm Dr. Tiffany Tan from Dental Designs Clinic in Singapore. We have branches located in the CBD as well as Orchard. So what are Invisalign attachments? Invisalign attachments are little white bumps that we put on the teeth in order for the Invisalign to grip onto your teeth more effectively. They are made of a filling material and they stay on usually throughout the whole treatment. So the presence of them acts as like a handle or a grip for the Invisalign to more effectively exert the pushing force onto your teeth. Many cases of Invisalign will require the attachments to be more effective. However, I would say that without attachments, the Invisalign aligners are still able to move your teeth. For more severe positions of crooked teeth, we may require the attachments on the teeth in order to more effectively move them to the position that we want. For example, a tooth that is rotated or turned around, in most cases will need an attachment on them in order for us to effectively move it. Because the tooth surface is quite round, most of our teeth are actually round and smooth. So if you imagine you're trying to open something, for example, that is very round and smooth, it's very hard to get a grip. But if the something you're opening has a bit of a ridge or ledge that you can hold on to in order to push and open, then it becomes much easier. So this is the same with attachments. It acts as a little grip for us to push more effectively. It also allows us to give targeted pressure onto certain teeth. For example, if we have teeth that need some pushing down, having an attachment on the tooth will allow us to be able to deliver that force to that tooth more so than another tooth that doesn't need that much movement. The attachments also act as a counterbalance to other movements. For example, if I'm having a case where the teeth are jutting out and I need to push it in, I will need attachments on the back so that as I'm pushing in, the grip on the back is very strong and it can allow for us to do that pushing movement on the front without much trouble. So how are attachments put on teeth? We put them on the teeth just the same way as we do fillings. So we have to clean first the surface of the teeth. After, we have to put something called an etchant, which is like a blue gel or acid that we put on the teeth. And it's a very weak acid just to clean the surface off of any organic substance. After that, the attachments are put on with an Invisalign template that is specially shaped with the attachments inside. And all this has to be done in a very dry environment, and usually in my practice it takes about 20 to 30 minutes to be done. It is painless, you should not feel any pain when this is happening. The attachments will stay on for the whole treatment usually, and sometimes during the treatment we may add or remove some attachments depending on how the movement is progressing, and also if we need certain more forces on the teeth, we may have to add more as well. Sometimes after putting on the attachments, they may drop off. This is usually because of excessive force being exerted on them, or maybe when you're eating, some of the food has pushed on it and then it's fallen off. So it can happen because the attachments are just bonded on the surface. We do not drill the surface for them to put on. So they are just holding on with the dental adhesive, and they can come off if there's too much force. Usually, if one or two attachments come off, it's not a cause for concern, but definitely always let your Invisalign provider know, your dentist know, so that they can determine if you need to go back for them to replace it or not. It is usually not an emergency. Your Invisalign is still the main thing that's pushing the teeth, so please do not panic if your attachments come off. And if you accidentally swallow your attachment, if it comes off, also do not panic. It is still safe because the material that we use for the attachments are a safe material. It's the same material as fillings, so they have been tested to be safe in case you accidentally ingest them. For myself, attachments are more visible, so they can detract from the appearance of the teeth, and some of my patients will ask if we can avoid having some attachments. I would say that for many of my cases, I will put other attachments so that we can avoid having attachments on our front 4 teeth, because the front 4 upper teeth will be the more obvious locations to have the attachments. So most of my cases will not have attachments on the front 4 teeth, but of course if these teeth need to be moved a certain way and it would be better with the attachments, I will be able to advise you and let you have that option to choose whether you want the attachments or not. The other thing is there are cases where maybe you would prefer not to have any attachments on the teeth. It is still possible to move the teeth. I have done cases like that where we just use the Invisalign itself. Again, the Invisalign aligner is the main pushing force on the teeth and the main thing that's moving the teeth. So without attachments, they can still move. Certain movements may be compromised and then the final result may be affected as well. So again, this is case by case and I will be able to advise you on what works for you and your teeth in terms of the movement, whether you need attachments or not, where we need the attachments and things like that. Lastly, I would say that the attachment material is quite important. The attachment material that we use tends to match very well with the color of the natural teeth, so they are less obvious. However, if a more opaque material is used, then they can be more obvious and more visible. So always check with your dentist if you're concerned about the appearance. What you search for online may not be the same material as what they're using and it may look better in real life. Lastly, what you should expect with attachments is also, because they are something that protrudes out from teeth, it is another area where it can trap more stains and more bacteria. So as you brush your teeth, make sure you're brushing all around it to avoid certain parts from staining more. With attachments, you do not have to avoid any certain types of food. You can eat anything you want as usual. You can drink any drinks you want as usual. And you do not have to take any special care when you're brushing. I hope that was helpful and could answer your questions about attachments. And please let me know if you have any other questions. Thank you. Bye-bye.